How to understand TPOAb lab reference ranges. Have you ever wondered what thyroid peroxidase antibodies mean for your health? Thyroid peroxidase antibodies, often abbreviated as TPOAb, are proteins made by your immune system. They mistakenly target an enzyme called thyroid peroxidase, which is crucial for producing thyroid hormones. Measuring TPOAb levels in your blood can help identify autoimmune thyroid disorders like Hashimoto's thyroiditis and Graves' disease. So, how do we understand the reference ranges for TPOAb? Most laboratories consider TPOAb levels below approximately 9 to 30 for international units per milliliter as normal or negative. Some labs might use less than 9, while others might set the upper limit at 30 or 34. These slight differences come from variations in testing methods and lab standards. If your TPOAb levels are elevated, it suggests the presence of thyroid autoimmunity. Elevated TPOAb levels are found in about 80 to 95% of Hashimoto's thyroiditis cases and 65 to 80% of Graves' disease cases. Interestingly, elevated TPOAb can also appear in 10 to 20% of thyroid cancer cases and in 10 to 15% of individuals without any obvious thyroid disease. This could indicate an increased risk for future thyroid dysfunction. On the flip side, if your TPOAb levels are very low or undetectable, there is no clinical concern. This simply means your immune system is not attacking the thyroid enzyme. The clinical significance of TPOAb levels cannot be overstated. Elevated TPOAb levels strongly suggest autoimmune thyroid disease and can guide diagnosis and management. For those with subclinical hypothyroidism, a positive TPOAb test increases the risk of progressing to overt hypothyroidism, which can influence treatment decisions. It's important to remember that TPOAb levels do not directly measure how well your thyroid is functioning. Instead, they reflected immune activity against the thyroid. Some studies even suggest that TPOAb levels within the normal range might be linked to subtle vascular changes, but this is not yet something that can be acted upon clinically. For both patients and clinicians, interpreting TPOAb results should always be done alongside thyroid hormone levels, such as thyroid-stimulating hormone and free thyroxine, as well as clinical symptoms. Reference ranges can vary from lab to lab, so always compare your results to the specific lab's normal range. A positive TPOAb test alone does not provide a diagnosis. It is just one part of a comprehensive thyroid evaluation. If your TPOAb levels are elevated, it may warrant monitoring and possibly further testing to assess your thyroid function and guide treatment. In summary, understanding TPOAb lab reference ranges means recognizing that values below about 9 to 30 for international units per milliliter are generally normal, while higher values indicate autoimmune thyroid activity. These results are essential for diagnosing and managing thyroid disorders, but they must be interpreted in the context of other clinical and laboratory findings. Always consult with a healthcare professional for personalized advice regarding your thyroid health.